Welcome. My name is Kerry Adams. I'm the CEO of the UICC in Geneva, Switzerland, and it's my great pleasure today in conversation to talk to Mark Middleton, a gentleman who I met several years ago in Geneva, who gave me an inspiring story about his company, the Icon Group, and what he was doing with that group. And straight away, we hit it off. And ever since then, we've been working partners, both at UICC, but also with the City Cancer Challenge. So, Mark, it's a great pleasure to welcome you today to our In Conversation. Perhaps we could start. Introduce yourself. Tell us about yourself and Icon. I'm sure people would love to know.
Well, firstly, Kerry, thanks very much for the invitation to join you in conversation. It's greatly appreciated. As you said, I'm Mark Middleton. I'm the global CEO of the Icon Group. We're now Australia's largest provider of private cancer care, and from very humble beginnings, from regional Queensland, which is where my first cancer centre was 14 years ago, and we're really proud of that history, which I'm sure we'll talk about a little bit. We've grown rapidly across Australia. We're now in Singapore, we're in Hong Kong, we're in mainland China, and certainly my vision is to continue to help as many people as we can, and that means providing access to cancer care in places where people haven't been before. So that's Icon Group in about 30 seconds. I hope that works for you.
Well, it does. I mean, I had the privilege of visiting one of your centres when I was in Australia a few years ago, before COVID, when we travelled around the world to see what we were doing in cancer treatment and care. And you also took me to a fantastic operation, which was preparing chemotherapy. So the Icon Group is not just cancer treatment centres, it's more than that, isn't it? Perhaps you could expand on that.
It is. So we wanted to build an integrated model of cancer care. And so what we have is the four foundations of Icon are chemotherapy compounding, which is one of the facilities you visited in Sydney, our pharmacy services, then we have our chemotherapy day hospitals, and then, of course, our radiation oncology centres. And sometimes we have all of those things under the one roof in an integrated cancer centre. And we also work really well with public hospitals, private hospitals, and indeed governments to provide all of those services or some of those services. And you're quite right, Kerry, we're actually now 68% of the chemotherapy compounding market in Australia. So wow. 68% of cancer patients in Australia have their chemotherapy prepared by Icon, and we've actually now partnered with the Auckland District Health Board in New Zealand to deliver all of the North Island of New Zealand's chemotherapy as well. So, and we want to continue to grow that part of the business as well. So, an integrated cancer care provider. Look, we're really, really proud of the amount of people's lives we can now touch each year.
Well, I remember a conversation we had when I was in Australia, and you were expressing a desire to break into Asia. And you were considering China mainland and Hong Kong and things like that. That's obviously been delivered. So, I mean, I've always felt that when you set out an ambition, you deliver it with your great team. So what are the challenges of entering the Asia market? Because it must have been a bit of a leap for you.
Well, it was. And I mean, we entered Singapore first. We've now been in Singapore for 5 years. And it was a market that we felt comfortable in. We felt it was, although it's in Asia, it has a lot of similarities with healthcare in Australia and all those sorts of things. So it was a market we felt we could ease our way into, and that's exactly how it's worked. Look, one of the things I'm most proud of in my career is not just saying we would develop cancer centres in China, actually do it. And we now have 5 Icon cancer centres in China and treating a lot of patients. And again, put together this wonderful team of professionals in China who couldn't be more engaged in the Icon culture and our sense of team and our sense of doing good for others. And that's been incredibly satisfying for me. Prior to COVID, I spent a lot of time in China and developed a real love for the people. And I hope it was reciprocated.
Well, I agree with you. We have the pleasure of having a board member from China and a board member from Hong Kong as well. So both represented on our board, and they're terrific people, and they work really hard for UIC globally. I'd like to pick up on something you said there, because it's a common trait across the whole of your team. You talk patient and you talk people, and it comes across in practically every time I've seen you do a presentation. You don't talk technology. You talk patient and people, and technology is in the background. And I know you've written a book of your experiences of going through COVID, which has just been published, called, and I'll repeat, Good Morning, How a Crisis Delivered Inspiration to Lead. I haven't got it yet. I know it's on its way. But tell me, why did you write that? Because I get a sense, having read a few of the reviews and spoken to people, that it's about your philosophy, about a business that's built around its people. So tell me about it.
What is, and I made a promise to our people 5 years ago that when I was in head office, I would say good morning to every single person. And I've held true to that promise. Can't do that when you're working remotely. So thus the good morning emails commenced, and they took on a life of their own. And it was the responses to my emails and the leadership learnings that I took out of that. And ultimately, Kerry, what it was about was keeping people connected when they were no longer physically connected. And I mean, you remember when we first hit this global pandemic and you had to send all your team home, I'm sure. People were scared. People were uncertain. What does this mean? What is the future? And I thought one way we could meet that uncertainty as a group was to stay connected. So what I urged all of our team to do is I want you to check in with each other every single morning. And I'll take the lead on that. And that means I'll email all 3,000 team members every single morning. And when you read the book, you'll see they started off quite simple, and then we covered a lot of ground, films, TV, music, anything I could think of to create connection and have people responding to me. And, the responses were sometimes overwhelming. We laughed, we cried. There's some incredibly personal things shared with me by team members, and it's undoubtedly the highlight of my leadership career. And I never set out to write a book. It wrote itself. In fact, I've said the team wrote it with me. And the book's the emails, the responses, some of them, and also my leadership learnings from each of those. What was a really, really meaningful time for Icon. And I'd like to think it was incredibly helpful of getting us through COVID in a really, really solid and successful state.
Well, I look forward to reading it, Mark. And I think when we spoke about it a few weeks ago, you mentioned that it was a bit of an eye-opener for yourself, a discovery about your own drivers and your own leadership inspiration that you've had in the past. And I know that you believe in constant education and inspiring people. So were there any learnings writing the book? Did you uncover anything about yourself which was a bit of a surprise or an insight that you didn't have before?
Well, Kerry, I think what came through really strongly with people, and it's something I've always known, but something I was able to share with people and perhaps articulate openly for the first time, was my gratitude to my own parents for the opportunity they had provided myself and my two older brothers. We came from humble beginnings, and my mum and dad always made sure we had opportunity, and that opportunity often involved being taken to the library to borrow books. And my father was a prolific reader. You can probably see the bookcase behind me. I have many of his books.
I can indeed. Normally you have to put your own book facing this way. That's what happens.
Yeah, no, I do. I do have a copy right next to me for anyone who's looking. But look, that dedication of my parents to providing opportunity, and my wife Susan feels the same, and that's why we launched the Middleton Scholarship at Icon. We wanted to provide someone with opportunity that they may not necessarily get, because we know what that opportunity means to your life and the way you approach life, your mindset. So I'm absolutely passionate about education, and I'm absolutely passionate about helping those who might not have an opportunity to get that opportunity. That I think that came through loud and clear, and I knew it was there, but it's a really powerful driver.
Yeah, you mentioned going to the library to collect books like you. I used to go there, get my 5 books or whatever the limit was, get back, start reading them, and then the week. Does that happen now, Mark? I don't know if people do that now. I think it's all on the web.
We certainly did when our kids were little. But the cap is always a problem, Kerry. If you can only borrow 5 books and you want 25. I don't think it happens enough anymore. A love of reading, as you well know, is the key to knowledge, and it's such an important part of my life. It was such an important part of my dad's life. It's such an important part of my kids' life. And I wanted everyone at Icon to know. And, when you see the book, incredibly touching emails from our staff who, my 10-year-old son had lost an interest in reading. I've just recommended to him the books you mentioned today, and he's reading. And, that means the world to me. That is very, very special. That some young kid's been encouraged to read because, a kid from Ballarat has written an email to their parents and just trying to connect.
That's tremendous. And you mentioned the Middleton Scholarship, which, of course, we work in partnership on, where you identify a specific individual in the Icon group who you wish to provide a year's worth of exposure, if not longer, I guess, of global health. And we work with them to provide the platform of UICC to introduce them to what we get involved with. And it's very much in line with the philosophy that we have, which is we have to give young leaders the opportunity to become great leaders in the future. So what was the inspiration for you there, and how do you think it's gone? How's it been for you?
Well, I wanted to do something meaningful around education. And, I was in the fortunate position that I could do that. And I also had a platform to do it because of Icon. And, I wanted, and it's really, again, it's about my parents. It's the Middleton Scholarship. It's about my parents. It's about my wife and I doing something for someone. And, so we're now, we're about to enter our 5th year of the Middleton Scholarship. And you've seen firsthand the Middleton scholars who've had the opportunity to attend UICC headquarters in Geneva. And if we put it into perspective, if we use Reese Fitzgerald as an example, who was in year 2, Reese is a radiation therapist from regional Queensland. He's a young guy who came to Geneva. I came with him. He had meetings with you. He sat in on a not-for-profit CEO forum.
Yep.
He heard about the global cancer burden. He heard about the challenges yourself and colleagues were facing in Geneva. I mean, what a world to be exposed to. Just so from my perspective, that kind of opportunity, means we're winning in that space, and we want to create leaders. And Courtney, who was our first Middleton scholar, got this wonderful picture of her standing next to Princess Dina. Yeah. Meeting Princess Dina, who was the UICC president-elect at that time, who was incredibly generous with her time. Again, Courtney's a kid from country Queensland, learning about leadership, learning about engaging and holding her own with anyone. And I can give you examples. Darian joining your round table recently with an incredibly esteemed panel of speakers, and there she was, sharing her thoughts about cancer care in New Zealand. So I think it's been a great success. I know the scholars have loved it. I'm looking forward to it continuing for many years, and also working with you and your team have been incredibly generous with your time.
Well, Mark, it's part of our responsibility, I think, as senior leaders in the global health space, is to encourage and give opportunity to younger people to become, those global leaders that we need in the future. And it's somewhat ironic that 2 of the young leaders that we started on with about 9 years ago, are now on my board, and they're my bosses. So that is a mark of success, when you get individuals like that who take a leadership role in global health, because they become inspired and we give them an opportunity. Mark, working with you has always been a pleasure, because some of the philosophy you have in Icon often reflects what we do in the UICC. And I know that, my team enjoy working with your team to look for opportunities all the time. So hopefully we'll continue with that. Good luck with the book. I look forward to reading it. At some point, I may get around to writing my own one, and I'll share it with you. But in the meantime, it's been great talking to you, Mark. Wish you the very best, and good luck with Icon as you continue to expand in Asia. I'm sure it's going to be an exciting few years.
Thank you very much, Kerry, and it's always a pleasure to speak with you. And again, a big thank you to you and your team. What is a wonderful partnership.
Talk to you soon, sir.
Thank you.